One of the most common concerns we hear from parents of newborn babies, it's either they are constipated for 4 to 7 days or they pass too many stools in a day. So it's actually pretty normal when your baby is not passing stools for 4 days to 7 days, or if passing too many stools if your baby is on exclusive breastfeeds. But you should pay attention if the stools exceeds more than 7 times a day with leaky or low stools. And this condition could be because of formil diarrhea, and this occurs because of shuttle feeding. And basically it occurs when the mother switches too quickly between the breasts. This leads to incomplete emptying of the breast, so that babies receive only formilk. So the condition becomes what is called as formilk diarrhea. Okay, so let's come to the topic now. Not all the nuances and real-time issues are learned through theories. Though we are specialists in this field, we see so many different patients every day, and it's through that hands-on experience we get better understanding and practical knowledge of the subject. For aspiring MD students, particularly in the field of pediatrics, it is super important to get this kind of practical experience. Here at Chettinad, with a regular inpatient or outpatient walk-ins, you get to handle different cases every day and get all the kind of exposure you need to become an expert pediatrician.